right, so I'm just going to be performing task number 21, which is a postmortem exam with a necropsy with one of my doctors here at my practice. So I have the RDVM records for my cat friend that we will be performing the postmortem exam on and the necropsy. So I have the patient history, some lab work that I'll go over, and then this is just my chart that I'll be using for my postmortem exam. I'll be noting any of my findings, and then down here I'll be noting any findings when I do the necropsy portion with my doctor. So to get started, we'll go over the patient's records that we have here. So again, this has the owner's name and the patient's signalment. So our patient is Sunny. He is approximately 4-year-old male neutered feline, domestic short-haired. So basically it looks like January 30th of this year, he presented to his RDVM because he had some vomiting and diarrhea for 3 days in a row, and owners were becoming concerned. No blood was noted in the vomit or the diarrhea. They did not want to admit him to the hospital, but the RDVM said that he was okay if they did want to just do some sub-Q fluids. So it looks like they gave sub-Q fluids, a dose of Serenia sub-Q, and famotidine sub-Q as well. It's noted that a couple of days later, when they called for an update, patient was doing better, and owners were very happy. And then the patient re-presented to the RDVM on June 13th of this year. It's noted that they were away on vacation for 2 weeks. The cat was staying with a family friend, and when they came home, it looks like he was dehydrated. Owners feel that he lost some weight. He was inappetent, not wanting to eat or drink. He was very lethargic, so owners were very concerned at this point because, you know, they haven't seen him for 2 weeks and they come back and he's looking really bad. So the RDVM at that point recommended admitting to the hospital to do some IV fluids, some IV medications. They also recommended at that point to do some abdominal x-rays, chest x-rays, and abdominal ultrasound. Owners declined the x-rays and the ultrasound, but they did agree to admit him to the hospital just for some supportive care and IV fluids and medicine. It's noted that he started eating a little bit while in the hospital. There was no diarrhea at that point. It was more so just vomiting, but he was not vomiting at the hospital. So he presented on June 13th, and it looks like the owners took him home on June 18th of this year. And then he was doing okay at home, so the owners were just, you know, watching him at home, seeing if he had any more vomiting. And then the patient, I guess, started declining again on the 4th of July, unfortunately, and presented to my practice here for vomiting and diarrhea. Again, no blood noted in the vomiting, but there was some blood noted in the diarrhea. He was lethargic, again, not really wanting to eat or anything. So we recommended admitting to the hospital again for some supportive care. Owners consented to that, so we got him started on IV fluids, and we did again some Serenia, famotidine, metronidazole, other medications IV. We also did recommend an ultrasound and some, you know, x-rays, but again, the owner declined. And unfortunately, over the last couple of days, he was not improving at all, and the owners made the decision to humanely euthanize him because they were just very upset with the situation, didn't have the funds to unfortunately do further investigation as to what was going on. So they elected to humanely euthanize him today, which is July 6th, 2017. And they also did sign a consent form that gave us permission to perform a necropsy just for educational purposes, just because they said it would make them feel a little bit better if, you know, if we ended up doing a necropsy, just if we find anything, just for learning purposes. They unfortunately did not want to be involved because they were a little too upset over the situation, which is totally understandable. So that's the history on this friend Sunny. And then just over here, we just have a little bit of blood work that was performed at the RDVM when he was admitted to the hospital in June. So as you can see, they did a VETT screen CBC. All of the values all over here, all within normal limits, nothing too concerning over here. Again, all all the values are pretty within the normal limits. There's just some elevation in his neutrophils right here, and a little bit of decrease in the platelets. But other than that, everything, as you see my other ones, all the other values pretty within normal limits. So unfortunately, don't have too much to go on based on the blood work that was performed. So again, that was the medical history for my friend Sunny, and then the lab work that was done, and all the other information done at the regular vet and at my hospital within the last couple of days. So now I'm going to go ahead, I'm just going to get a towel on the table, I'm going to get Sunny, my feline friend, and I'm just going to perform the next portion of the video, which is the post-mortem exam.